Thanks, Harry. Good morning, everybody. I'm Babz Rawls-Ivy. Welcome to the second hour of LoveBabz Love Talk, where I'm talking. So this morning, I'm grateful to have Amanda Skinner and I believe Gretchen Rafa will join us too. They're going to be here repping Planned Parenthood Votes, Connecticut, and we're going to be talking about the current state of abortion access. And we have a laundry list of things that we want to get to. So, good morning, Amanda. It is so lovely to see you.
Good morning, Babs. It's lovely to see you too. I am sure that my colleague Gretchen Raffo will be with us momentarily.
I'm sure. And I want everybody to know I'm on the board of Planned Parenthood Southern New England because I want people to know because people will make that a big issue if I don't say it. You didn't say it. So I'm saying it. So I'm happily on the board of Planned Parenthood Southern New England. How are you? it's
Am
been
I?
it's been a crazy couple of weeks.
It's been a crazy couple of years, but it's definitely been a crazy past few weeks. How am I? I am feeling very motivated to keep doing the work. I am fired up.
Okay.
That's how I'm doing. I am fired
Wow.
up, and I see that Gretchen is getting on now, so that's great. Gretchen is our Senior Director of Public Policy, Advocacy, and Organizing, and is the lead person on all of our public policy, advocacy, and organizing work in Connecticut, and leads the work for Planned Parenthood Votes Connecticut as well. Hey,
Okay.
Gretchen.
Good
Good morning,
morning.
It's
Good
so
morning,
nice to
Beth.
see
Thank
you.
you. The joy of
Nice.
Zoom. Sorry, I was having Zoom issues.
That's all
Thank
right.
you.
Listen, I have them every day, every single day. So, listen. All right. So, and we have about a 45-minute conversation. I want to get right to it. Talk to me about the current state of abortion access. Where are we? Because I know everybody's feeling. Listen, when Harry
Yes.
Droz, my producer, says we got to have Planned Parenthood folks on because I feel some kind of way about what is happening in Mississippi and Texas and all the things. So if he is saying that, then I know the whole country is feeling it.
Yeah. Yeah, I mean, I think it's fair to say that we are at the most critical point in abortion access in this country since Roe v. Wade became the law. Um, we are seeing two very serious, pressing, direct threats that are of this moment that I know we'll talk about today. One is the still in effect law in Texas, SB 8, which has banned abortions after 6 weeks and has averted typical through the judiciary typical constraints on these kinds of laws by employing a very creative strategy to have there be civil enforcement of the law rather than state enforcement of the law. But what that has effectively done, and we can certainly talk about more about what that means, what that has effectively done has made abortion almost entirely inaccessible in the state of Texas, which everybody knows is a very large state with large rural areas, with large immigrant population, with large communities of color. And so we are seeing the harmful impact of this ban most significantly on those communities, people who, maybe migrant workers who maybe don't have transportation or paid time off of work. So really, truly, for a large part of the population of Texas, abortion is basically completely inaccessible to them. And then we are also seeing in the Supreme Court that the Supreme Court has heard oral arguments on a challenge to a law in Mississippi that bans abortion after 15 weeks. Now, the thing that makes this important now, well, there's a couple things. So one is that laws like this Mississippi law have been heard repeatedly since Roe v. Wade became the law, and it is very clear that this is an unconstitutional law. Based on precedent, it is clearly unconstitutional. So then one might ask, why is the Supreme Court hearing this law? So the ban in Mississippi is a 15-week ban. The case is Dobbs v. Jackson. And why is the Supreme Court hearing this case when the appeals courts have all found that this law is also unconstitutional based on 50 years of precedent? Well, this Supreme Court is made up of a very different body of justices now than it has been. And we are seeing the impact of a long strategy to stack the courts, to overturn Roe, to restrict access to abortion. And we are very clear that if the Mississippi case goes the way we fear it will, which is that Roe will either be overturned completely or severely constrained, that abortion may become completely inaccessible for over 36 million women in the United States of reproductive age, that there will be huge swaths of the geography of the country where there is no access to abortion, that abortion will effectively be accessible only to people living sort of on the left and right, and even on the right, the sort of northern right parts of the United States. And I mean geographically, like west and east, with little tiny physical pockets of geography in the middle of the country where there may still be abortion access. So it's a red alert moment. That's what we are at. It is probably one of the first times that we will see the Supreme Court consider a case that would actually take rights away from people rather than expand people's rights.
So do we have a sense of what this Supreme Court will do? I mean, I'm hearing rumblings that they're not going to undo this, but we can't bet on that either. So
bet on that. I mean, I guess what I'm asking myself, and I would invite Gretchen to add her thoughts as well. What I'm asking myself is, again, why did this court choose to hear this case? And when we listened closely to the questions that were being asked of the attorneys during the oral arguments, and to the perspectives being presented by the justices, while it may be, the attorneys from Mississippi directly asked the Supreme Court to overturn Roe versus Wade completely. That may not be what happens, but that sounds like there might be some middle ground result where maybe they just constrain access rather than overturn Roe versus Wade completely. And it's our very strong perspective that this is not a middle ground issue, that either people have agency over their bodies or they don't.
Gretchen, you want to jump in here?
Yeah, I mean, Amanda hit the nail on the head. I think as an advocate and an organizer, I don't really like to scare people, but I think the justices really, as they spoke, kind of let us know where they were at in terms of their really politicizing the issue, and that's not the job of the courts. And I think this is a red alert moment, because what we heard very loud and clear from the majority of the justices is that they do not see Roe as a fundamental human right, that the Constitution does not protect that. And it's a very startling reality that we are in right now. And so when I say I was scared when I was listening to the oral arguments, I was scared. This is a terrifying time when the court might be deciding on who has the right to control their bodily autonomy, like to have bodily autonomy and control their bodies, control their reproduction. So I think the fear that I have is more to also inspire people to action, because I think it is very clear from those oral arguments, and I trust legal experts that have analyzed this to believe that we are looking at the summer of 2022, where 50 years of precedence is erased.
So Amanda, y'all talk to me about this Mississippi, Texas situation. What does that mean to us, and how should we think about this or understand what is happening there?
So the first thing, actually, Babz, if I may, is Gretchen said something that I think was really important, because she said, who has the right to control their body? And I think it's important for people to just sit with the reality that people of means, people with resources, are still going to have choices. Those folks are still going to have the ability to control their own bodies. If you have the money, if you have the family resources, if you have the capacity to get on a plane and fly somewhere, if you have paid time off of work where you can go do that, if you have the support of your friends and family, you will still have the ability to control your own body because you can go someplace else. So the people who will be most harmed by this potential outcome are people who don't have those choices, people of low incomes, typically people of color, Black people, brown people, immigrants, indigenous people. So when we think about like the laws creating who gets to actually control their own bodies, this would, potentially be a circumstance where we are enhancing health disparities through a legal action of the Supreme Court and a judicial action, rather than diminishing disparities in health outcomes, rather than diminishing economic injustices. We would be enhancing economic injustices. We would be enhancing disparities in health outcomes. We would be enhancing and sort of perpetuating cycles potentially of poverty and oppression. And I just think we can't say that frequently enough, that that laws are not just if they disproportionately harm certain parts of the population, and particularly when those parts of the population are driven by systemic, those differentiations are fundamentally driven by systemic oppression already.
Mm-hmm. Mm-hmm. Yep.
So thank you for allowing my soapbox on that, and we'll probably say
that's all right.
I think, going back to Texas and Mississippi, what we're seeing in those states is actually not uncommon. Over 600 bills have been introduced across the country, in states across the country, this past year that would constrain access to abortion. Over 100 of those have been passed into law. We have seen repeated efforts over the last decades, but significantly in the last several years, sort of the culmination of a long game, politically motivated strategy where abortion is used as a wedge issue to stack representation, to shift voting patterns, to enhance a particular sort of political agenda and a particular economic agenda that freedom is not at the center of, and that people's ability to control their own bodies, their own health, and their own lives is not at the center of. So what's happening in Texas and Mississippi is not uncommon. What's unusual is, in the Texas case, is the way they constructed the law. They have been able to avert accountability for the overt unconstitutionality of the ban by not having the state of Texas be the agent that enforces the law. So the way the law is written is that abortions are banned after 6 weeks or at the first detection of fetal cardiac activity. And the way that is enforced is that literally anybody, anywhere, can file a lawsuit and collect up to at least $10,000 in damages against anybody who assists or attempts to assist somebody in having an abortion after 6 weeks. So that $10,000 suit can't be filed. Let's say I'm the individual who has the abortion. I'm not going to get sued. It would be maybe my mom who helped me pay for it, the healthcare provider who performed the abortion, the Lyft driver or car service driver who drives me to get my abortion, the friend who helps me get time off of work by offering to cover childcare for me so that I can go get my abortion. So any assisting or abetting of a person getting an abortion after 6 weeks, any person who does that exposes themselves, and this is within the state of Texas, obviously, if the abortion occurs within the state of Texas. And these lawsuits can be filed by anybody. They could be filed by an abusive partner. They could be filed by an estranged parent. They could be filed by neighbor down the street who has a different point of view about abortion. They could be filed by a complete stranger. We've actually seen some suits filed by people from other states who don't even know the individual who may have had the abortion.
And the courts are allowing these suits?
Courts are, yes, because within the parameters of the law, the way the law is written, this is
so
actually...
who is paying this money? Who pays this money?
Well, so the person being sued would be responsible for their own defense, can also be asked to pay the legal fees for the plaintiff, the person filing the suit, and the person filing the suit can get a minimum of $10,000. So that's basically like turning individual people into bounty hunters. It's like abortion bounty hunters.
This is like slave catchers. I prefer slave catching.
It's unbelievable. It's unbelievable. It's unbelievable that the court actually heard arguments about like that would give them the opportunity to enjoin this law. Because again, it's so clearly, if you consider Roe and Casey as precedent, it is so clearly unconstitutional to be banning abortions at 6 weeks. And they still haven't ruled on the opportunity to enjoin the law. That would make the law not in effect. So this law has been in effect since September 1st. Months have gone by. And again, we are seeing the harmful impacts of this for people in the state of Texas. Literally therapists have had to be called in to support staff in Planned Parenthoods across Texas, in other community healthcare providers that provide abortion services, to counsel the staff, to counsel the patients. People are coming in the doors, just sobbing and devastated, finding out that they can't access healthcare that they need, and healthcare that is clearly protected by the Constitution.
Gretchen, you want to jump in?
No, Amanda's getting me all fired up.
I'm trying. I'm fired up.
I know. I think what is just continues to sit with me since last week's oral arguments is this, idea. And Julie Reichelman from the Center for Reproductive Rights was the lawyer arguing the case. It was, so forcefully arguing that our very right to determine when and if we become pregnant, our self-determination is predicated on our ability to be seen as free and equal citizens in this country. And the fact that that is, up for debate, forcing people to carry a pregnancy against their will, is just, it's quite shocking to me. I mean, it's just, we are at an alarm, like this is just an alarming and terrifying time. And yeah, so I was feeling that energy and keep hearing what, Julie Reichelman was arguing in court, that this is about our ability to be free and equal citizens in this country. And again, Amanda listed, who is impacted the most by these dangerous bans, and it is it's really the urgency is like never before in terms of abortion access in our country.
So talk to me about the Mississippi component to this, because I watched the sister who runs the only center, I think it is a Planned Parenthood center in Mississippi, the only one. And she was talking about how, this has been, because women from Texas are coming over to Mississippi, and it has been overwhelming for her and her team and her staff. And they're committed to this work, but, this has put them in an impossible situation. So talk a little bit about what you know about what is happening there.
So the one abortion provider in Mississippi is Jackson Women's Health Organization. So it's just to differentiate, it's not a Planned Parenthood Health Center, it's Jackson Women's Health Organization. And the case is Babz v. Jackson Women's Health Organization. And the state health officer is Thomas Babz. He's the named as the petitioner in the case. And again, what Mississippi did was pass a law that said that abortion access is restricted at 15 weeks. Now that law has been enjoined, so that law is not in effect in the state of Mississippi. Because again, when you look at the precedent of Roe and Casey, so Roe says placed a viability standard of 24 weeks on the access to abortion, and then I'm summarizing, obviously. And then Casey said, basically, this was a 1992 case, that there cannot be, additionally, there cannot be undue burden placed, that there can be what seemed like reasonable, depending on who is considering what reasonable is, but reasonable constraints or regulations around abortion access, but an undue burden cannot be placed on people being able to access abortion in accordance with the tenets of Roe, which extend up to viability or 24 weeks. So with that in mind, an outright ban on abortion after 15 weeks is clearly unconstitutional. All of the courts and appeals courts that have heard this case so far are like, yes, unconstitutional, enjoin the law. Nope, law can't go into effect. So that law is not in effect. So it is the case that we are seeing in certain states an increase in abortion services being provided because those people who can travel outside of the state of Texas, and again, keep in mind, everybody visualize how big Texas is and how hard it is, depending on where you live in Texas, to potentially travel across the border. But if you are capable of traveling to Nevada or Oklahoma or maybe to Mississippi, we have even had a patient come to Texas saying, come to Connecticut saying, I live in Texas, but I, had the ability to get myself here to Connecticut, and so I came here to access an abortion. This just happened last week. So people are going where they can. So in addition to the burden of fighting against this obviously unconstitutional law, also the Jackson Women's Health Organization is dealing with an increase in demand because of the law in Texas. And what makes, again, the case in Mississippi so scary is, I have in conversations said to folks, I am very, what's happening in Texas is outrageous and devastating and directly and immediately harmful. What the Mississippi case is the particularly scary one to me, because right now, as it relates to Texas, the Supreme Court isn't actually the question at hand, and the issue they're contending with isn't the constitutionality or unconstitutionality of the law. It's whether or not there's proper standing to challenge the law, which is like legal wrangling, but that's the issue in Texas. And so I do feel like it would be fairly clear, even in an appeals court, if there was a straight up-down question on the constitutionality of a 6-week ban, it would be like, yes, clearly not constitutional, and the law would be enjoined. The issue with the Mississippi case is that the Supreme Court has agreed to hear that question. That is the question they've heard. Is this ban constitutional or not? The Supreme Court has the duty of, interpreting the Constitution, being guardians of our freedom, and determining if something is constitutional or not. And that is the question that they are contemplating when they consider the Mississippi case. And they have been asked to directly and completely overturn Roe. We don't expect a response from the Supreme Court until June of 2022, so it would be the beginning of next summer. But as they consider this, we have a 6-3 conservative majority in the court. The court is clearly politicized. There was at least one justice citing their religious morals as guides of their decision making, which is not the duty of a Supreme Court justice. Their duty is to interpret the Constitution. And this particular case is the opportunity for this newly very conservative Supreme Court to either overturn Roe completely, as they have been asked to do, or to change the parameters in ways that would severely constrain access to abortion. And again, we have, I think, 10 or 11 states, I think 11 states that have trigger laws on the books, where as soon as the Supreme Court gives them the opportunity to, laws will go into effect that will, in accordance with that, constrain access to abortion in their states. An additional 15 states where we expect abortion access to be, again, made completely completely wiped out if that's the opportunity, or constrained within the parameters of whatever any new Supreme Court finding says. I think there are maybe two other things that are coming to my mind that make this such a big deal. So one is, again, why would the court agree to hear this case when it's so clear that the law is unconstitutional based on every consideration of a case like this previously? The only reason to do that with a newly conservative Supreme Court is to take advantage of the opportunity. So that is, I think, one of the issues. And then the other issue is that what I can envision happening is that the states where they will attempt to constrain abortion access will be creating new opportunities for new ways to challenge even whatever finding the Supreme Court has here.
Mm-hmm. So I heard Amy Klobuchar say that that the federal government that they could codify this into federal law. How hard would that be? Like, she just said it, and I thought, well, we've done that in Connecticut. Why couldn't we do that, at that level? What are your thoughts on that, Amanda and Gretchen?
Gretchen, why don't you take that one?
Yeah.
Is that too much like a dream?
I hope not, but I'm going to be real with folks too. And again, I don't want to scare you, but I want to urge you to action. There is an opportunity for Congress to act, and there is a bill that already passed the House. It's called the Women's Health Protection Act, and the United States House of Representatives already passed this. We are waiting for the Senate to take action. A big thank you to our U.S. Senator Richard Blumenthal for reintroducing it again in this Congress. This is an important step to protect access to safe legal abortion across this country. Even if the court does not completely overturn Roe, we need this law in place. This is critical because it will not only protect safe legal abortion, it will also safeguard against these medically unnecessary, abortion bans that Amanda has been lifting up, that politicians across this country continue to push. Over 100 have already been passed out of the 600 introduced this year. So we need Congress to act on this. The challenge is getting it through the Senate. I mean, I'm gonna be brutally honest that we need to get the votes in the Senate. So I will say to you all, if you have, friends and family in other states, the West Virginia and the Arizona, we need all Democratic senators to vote for this. And we need to urge our friends and family in other states to call their senators and say it's time to pass the Women's Health Protection Act. And I say we need West Virginia and Arizona because we need Manchin and Sinema to vote for this. And
so, Gretchen, if they can do this at the congressional level, will that shut down all these things that the states are doing individually, like all these things that are happening in Texas and other states who are trying to enact all these highly restrictive laws?
Yeah, it will help. It doesn't mean that state legislatures won't pass unconstitutional bans, because that's what we've been seeing, right? This is, again, as Amanda pointed out, this is how we got to this point. This is not just a new fight. As you know, Babz, this has been happening for years and quite honestly, decades. This has been, the urgent moment. The anti-abortion movement has been mobilizing, including ensuring that the courts are stacked with judges that have said that they don't believe that abortion is protected in our Constitution as a right, and have said that they will overturn it. So it's not the end of the fight. And I also want to bring it back to the point that legal right does not mean access to everyone, right? So even though abortion is still legal in the United States, we know that there are so many people that face significant barriers to accessing the care they need. Bringing it back to Mississippi, there is one abortion provider. This is the last abortion provider. Jackson Women Health Organization is an independent abortion provider. And I want to take the moment to lift up independent abortion providers, because in some states, they are the people on the ground, the providers on the ground, and the only providers on the ground that are giving people access to the abortion care they need, and independent abortion funds that are helping people who are facing significant barriers, whether it's financial, transportation, et cetera, providing resources to people to access the care they need. So, so I'm not saying that Women's Health Protection Act is going to be the answer to all of this. You know, this is, again, I'm going to bring it back to like the simple fact that was what is up for debate in the Mississippi ban is whether states get to determine who is free or who is not free. And, you know, this is particularly alarming in states like Mississippi that also has one of the highest maternal mortality rates, the highest infant mortality rates. You know, and these are the folks,
poorest state in the country.
Yeah, yeah, and these are the folks that are going to be impacted by the decisions that the Supreme Court is making. So, so when we say this is about abortion, it is so much bigger than that. When we are thinking about abortion care as part of like the spectrum of in the spectrum of reproductive health care, that, and in the spectrum of maternal health care. When we're talking about abortion care, we're talking about maternal health, because again, this all is linked to who is free and who is not, and who gets to determine, you know, what happens to their bodies. And so I think that is really an important piece of the argument. So, so I don't want to say policy is the answer to everything, because we know that, you know, that does not equal justice for all of our, you know, all of the people that rely on Planned Parenthood for healthcare, or again, that are facing systemic barriers to healthcare access in this country.
So talk to me, Amanda.
Can I just say one other thing, Babz? Maybe this is where we're going anyway. But the other thing that is so alarming about this moment is that Roe v. Wade is it is wildly popular. 80% of Americans support Roe v. Wade. 80% of Americans want to see Roe v. Wade be the law of the land. Mm-hmm. So that this is even hanging on by a thread is astonishing to me. And particularly when we see some of the like really appalling, diminishing, sexist, racist rhetoric that is being used to try to advance an anti-abortion position, that, you know, effectively, as Gretchen said, you know, turns women into, and anybody who can get pregnant, into a position where they can be forced to carry a pregnancy to term, and using rhetoric to suggest that that's like no big deal. Like, oh, it's fine, you know, like they could just give the baby up for adoption. Adoption is wonderful. That's absolutely a choice.
Adoption is wonderful, but let me tell you something, because I'm a mother who has adopted 4 children. I get it, but we are overwhelmed with children in this foster care system as it is right now across this country, predominantly Black and brown children who need a forever home. And so I you know, I hate when people bring that into the conversation, because it's just so disingenuous, and it's just such an ignorant sort of thing to sort of say, well, why don't these women just turn their babies over and give them up to adoption? And not knowing the state of affairs of adoption in this country just says to me, they're just so out of tune and out of touch. And it's fairy tale-ish, you know, because we're not interested in adoption in this country in the way that we so want to level it as some sort of anti-abortion rhetoric. Listen, that's not the answer. That is not the answer. So,
and these same people are not plowing resources into school systems. They're not plowing resources into better access to healthcare. They're not plowing resources into access to birth control. They're not plowing resources into mandating sex education so that people have truly good, high quality information to be able to make choices about their body. Like, it's not like the folks who are trying to constrain access to abortion are furiously working to ensure the most expansive access to healthcare services for all people in the world, or justice in people's ability to parent and have families of their choosing if they do choose to become pregnant and carry a pregnancy to term. That's not what's happening. Because the same folks that are trying to constrain access to abortion are by and large also people who want to restrict and constrain resources going into education, resources going into healthcare, resources going into community well-being, resources going into education, sex education. It's the same people.
So before we go, because we have to wrap up, talk to me a little bit quickly, if you can, about what's happening. How does this affect us in Connecticut? Does this mood have some bearing on what we do here in Connecticut and Rhode Island?
Yeah, Babz, thank you. So, right, Connecticut has been a national leader in safeguarding and advancing reproductive rights. Yes, we have codified it into state law more than 30 years ago. But again, I'm going to go back to the point I want to keep making. Legal rights are meaningless if people don't have access to it, right? We know that people in Connecticut still can't access affordable health care. There is pervasive systemic barriers that is really widening disparities in our state. Healthcare coverage, and costs keep increasing. So it really is important for us, again, to fight for the people that are most impacted by these bans, including in the state of Connecticut. We are part of the Husky for Immigrants campaign, and this campaign is working, tirelessly to ask our state to open up our Medicaid program to immigrants regardless of their immigration status. Because we know for undocumented individuals in our state, they are shut out of the public and private health insurance programs. And that is one step that Connecticut can do to ensure that people have access to the health care they need, including abortion care. So that is a really important next step. And we have to, again, continue to think about the barriers that are impacting people's ability to get to their healthcare appointments, to ensure that they have childcare to get to their healthcare appointments. So again, I think what we need to really think about is how we address systemic racism within our state and coercive reproductive policies that continue to harm Black and Brown women and people who can become pregnant, to ensure that their legal rights are actually accessible.
Okay. So quickly, who do people call, or how can people get involved? How can they raise their voice? How can they get on the ground and help and support and fight for women?
So I'm going to jump in with one thing, and then I'm going to turn it over to Gretchen, who's going to give you the litany of here's what you can do. But one of the things that I think is most important, first of all, I would love to see us in Connecticut be a beacon of hope in this country, an example of a state that is like, this is what it looks like for people to have real access to healthcare. As Gretchen mentioned, yes, we have the floor, we have legal access to abortion in this state, but there is so much more we can do to take down barriers to being able to access care, and for people to have real agency over their own health, their own reproductive lives, their own sexual lives. One of the ways that we do that is by destigmatizing abortion and destigmatizing sexual and reproductive health and sexuality. And so what I really hope is that people will think about sharing their stories. Every single person loves somebody who has had an abortion. 1 in 4 women in the United States has had an abortion. So unless you know less than 4 women, you probably know somebody and love them who has had an abortion. So we need to start talking about our stories. We need to normalize abortion. It is a part of healthcare. It is a normal part of healthcare. There are a lot of reasons that people choose abortion as the right choice for them. Sometimes it is because they simply did not want to be pregnant or become a parent. Sometimes it is because they discover that the fetus has an anomaly that is incompatible with life. Sometimes it is economic reasons. It doesn't matter. I think sometimes we talk about abortion in a manner that suggests that there are acceptable reasons and unacceptable reasons for people to want to have dignity and choice over their bodies, when in fact there is an acceptable reason, and there is one acceptable reason, and it is because the person who is pregnant does not want to be pregnant for whatever are their particular reasons in that moment. And it is up to them to make that decision. So I think one of the most important things we can do is tell our stories, talk about our abortions, talk about our choices to have families or not have families in a really open and honest way. We were at a storytelling event a few weeks ago where it turned out that one of the people sharing their story had shared it with their 3 best friends they'd been friends with for 20 years. Their 3 friends had all had abortions too, and none of them had ever told each other after 20 years of friendship.
Wow.
Like, that shows how deep the stigma goes, and we absolutely have to disrupt that. But there are also additional very specific calls to action and things that folks can do. So I'm going to turn it to Gretchen.
All right. Okay, Gretchen, you got 1 minute because I got to go because, show's behind me.
Well, I think Amanda brought it home, because I think my question to everyone listening is, what are you willing to do in this moment to step up to protect abortion access? And that means please follow us on social media at PPVotesCT to get up to minute information on how you can take action. Follow the Husky for Immigrants campaign and vote. There are important elections, special elections, election 2022. Talk to your elected officials about this issue and why abortion care is health care, and it needs to be protected, it needs to be defended, and access to health care needs to be more available to everyone that needs it.
Okay. Thank you so much, Amanda Skinner and Gretchen Raffa. I so appreciate y'all coming on. Planned Parenthood Votes, Connecticut. And I hope you come back and keep us updated on the progress as this moves through the court system and moves through. And thank you.
Thank you. Thank you for having us, Babz. Great to see you.
Important work. Thank you. Thank you. All right, y'all.
Thank you.
I will see y'all tomorrow. Thank y'all for tuning in. And y'all be good out there and watch the weather today. I'll see y'all.
Hi, this is Babz Rawls-Ivy from New Haven, Connecticut, and you're listening to WNHHLP 103.5 FM, streaming live at newhavenindependent.org.